Welcome to Investigator Insights, the emerging role of cyclin-dependent kinase 4/6 inhibitors in breast cancer. I'm Elizabeth Reed from the University of Nebraska, and I'm happy to be speaking with Dr. Cynthia Ma from Washington University today regarding this subject. Welcome, Cynthia.
Nice to be here.
Nice to have you. In this year's American Association for Cancer Research meeting, the results from the Paloma 1 trial were presented, the phase 1b/2 trial. Can you discuss those results a bit?
Yes, so Paloma 1 trial is a randomized phase 2 study of palbociclib, a CDK4/6 inhibitor. The trial trying to evaluate its activity in patients with metastatic estrogen receptor positive, HER2 negative breast cancer who had not had any prior treatment for their metastatic disease. So the trial randomized patients to receive either letrozole or the combination of letrozole with palbociclib. The trial focused on postmenopausal women. So the trial does have two parts. In the first part, they enrolled all patients who are eligible. The second part enrolled only patients who have tumors with cyclin D1 amplification or P16 loss. So cyclin D1 is an activator of CDK4/6, and P16 is a negative regulator of CDK4/6. In breast cancer, especially in the estrogen receptor positive breast cancers, there have been amplification of cyclin D1 and loss of P16. So this leads to activation of the CDK4/6. So the second part aimed to test whether these two can be used as biomarkers of predictors, of response to palbociclib. And so the trial results was presented at the AACR. The progression-free survival was found to be significantly improved with the addition of palbociclib. And this improvement was found to be true when all patients are combined from both parts, or when the two parts are analyzed separately. So when all patients were combined from two parts, with letrozole alone, the progression-free survival was 10.2 months, but with the combination, the progression-free survival was 20.2 months, which was significantly improved. And also in the trial, they found that the overall response rate was improved from 34% with the single agent letrozole to 43%. And the clinical benefit rate was up to 80%, so it was significant improvement. The p-value was very dramatically increased. So the safety was found to be very well tolerated. Neutropenia was the most common side effects, but was not associated with infection. Otherwise, the drug was tolerable.
Why did palbociclib get breakthrough designation from the FDA?
So patients with metastatic estrogen receptor positive, HER2 negative breast cancer are mostly not curable, and we need new medications for these patients. So the standard of care usually are aromatase inhibitors in this patient population, but many patients do not respond. And palbociclib, as presented as a result from the phase 2 study, the significant improvement in progression-free survival offers hope for this patient population. So the designation for the breakthrough drug makes the expedite the approval process so that a more effective drug or a new effective drug can be introduced to this patient population quicker.
Does letrozole in the adjuvant setting make the results of Paloma 1 difficult to interpret?
So in the Paloma 1 trial, majority of the patients, or half of the patients actually never received any adjuvant treatment because they were de novo metastatic patients. But there were over 30% of the patients had received adjuvant hormonal therapy, including aromatase inhibitors such as letrozole, although that's a very small number of patients. Most of the patients received adjuvant tamoxifen in that trial. So in their subgroup analysis, at least when looking all the hormonal therapies together, they still found the benefit of palbociclib in that population. So extrapolating that, patient who had adjuvant letrozole not necessarily may not benefit from the treatment.
In 12 months from now, what percentage of frontline patients with ER-positive, HER2-negative breast cancer do you expect to use palbociclib in?
So palbociclib is still not being FDA approved yet. So the phase 3 study of letrozole with or without palbociclib has just completed enrollment. But the FDA has granted expedited review for the new drug application for palbociclib in combination with letrozole as first-line treatment for metastatic estrogen receptor-positive HER2-negative breast cancer. So the decision for that application is expected to be April 2015. So I think if we did get approval from FDA of this combination, then we would expect the majority of our patients would receive this combination as a frontline treatment, because of the tolerability of palbociclib. But if it is not approved yet, and also in the meantime, there are trial opportunities for these patients.
What are the most important things clinicians should remember about the cyclin-dependent kinase 4/6 inhibitors in the first-line setting?
So what I would say is that these are very exciting drugs, and in early phase trials, they have shown very significant benefit when combined with hormonal therapy, at least for the trials of palbociclib. And the FDA is granting the expedited review for the approval of this palbociclib with letrozole as first-line treatment for metastatic breast cancer patients. So we just have to look out for that.
Well, we're all excited to see what the next year brings. Thank you.
Thank you.